Bring the patient's head into my lap here. Bring the spine into neutral. Grasp the spinous process and transverse processes. Apply compression from the head through to the segment. Bring the segment with my hand into ease. Palpate the release. Relax the compression. Recheck. Done. Bringing the thoracic spine into neutral. Compressing with this hand and this armpit on both shoulders down. Positioning the segment into its area of ease. Palpating the release. Done. Patient is lying lateral recumbent on his opposite side. So he is rotated left. I have him laying on his right side. I apply the compressionary force from this hand through the greater trochanter down to the segment, again having the spine at neutral. And I rotate him with my shoulder this way, side bending him further. And there's the release. We begin with the transverse arch between the second and third toes, palpating for tenderness. Scream if it hurts. Going to the fifth metatarsal cuboid attachment. No screaming, that's good. Going to the lateral aspect here, touching the talus. Pressing anteriorly, inferiorly, and medially. I don't feel any screaming. Pelvic side shift is lateral translation, checking for ease. His ease is to the right. Pelvic rotation is testing for ease this way. And again, it's rotated to the right. Checking for iliorotation. ASIS compression to determine the stuck side. ASIS check. PSIS check. Or you could rotate them all the way onto their back to check that way. This is the rotated side. Straight leg raise until you palpate motion in the hip. If you do ipsilateral leg, you must do ipsilateral hip. He's restricted on this side. Can you bring your legs up to your chest? Thomas test. Drop that leg down. I have 2.5 fingers of width. Bring back up. Drop this leg. 2 fingers. Dysfunctional leg is put down in the Thomas test position. Leg is raised towards the ceiling. Physician resist for 5 seconds. 4, 3, 2, 1. Relax. Bring this leg up. Drop it. 1.5 fingers. Treatment successful. Patient is put at palpable motion at the hip, at the feather edge. Bring your leg down to the table. The motion you are palpating for is in his hamstrings, which is between your hands. Alternatively, you could put your hand on the hamstrings to palpate the motion there. Relax. No further motion is appreciated in the leg. All further motions up in the hip. So, recheck. Leg has much greater range of motion through the hamstrings. Hamstrings, gluteus maximus, and the lumbars. Bring your toe up onto your toe there, perfect, and lift your leg up slowly. Good. Patient contracts first hamstrings, then glute maximus, then lumbars. Test pass. Gluteus medius, tensor fascia lata, quadratus lumborum, lumbar muscles. Bring your leg out towards me. Lumbars fire first, then glute medius, then tensor fascia lata. Test failed. For treating adductors, use muscle energy. Bring your leg in towards me, extending out the adductors to the feather edge. Taking it to the final barrier, final stretch, and returning it to its original position. Rechecking, adduct your leg out, bring it back in. Small improvement. For problems with extension, you do a Thomas test treatment of the psoas. You bring your legs up to your chest, Thomas test, drop that leg down, 2.5 fingers of width, bring back up, drop this leg. Upper cross syndrome first test of the head and neck flexion. Can you look at your legs? Patient's head comes up first and then tilts forward instead of curling forward. Test failed. Can you curl your head forward straight from your chin? Thank you. That's the proper test. When patient looks at his ankles, he will deviate towards one side or the other. deviates to the right side, indicating the problem is on the right side sternocleidomastoid scalenes. For a right sternocleidomastoid, you do ipsilateral side bending, contralateral rotation, and extension. Can you bring your head back to its resting position? And relax. And again. And relax. Good. Also treating scalenes. Can you look down at your feet? Relax. And again. Good.
If you're treating the right sternocleidomastoid, we will also treat the right anterior scalene. We just need to treat the sternocleidomastoid, and then we'll treat the anterior scalene.
Suboccipital release. Hold until the muscles soften. Done. Abduction of the shoulder with the elbow flexed at 90 degrees. And can you raise your shoulder up and stop when I tell you to? Stop. Feeling the shoulder girdle lift. Measure this angle. That is below 60 degrees. This is a fail. Hand stabilizes the scapula. Other hand distracts the head. You bring your head to your right shoulder. Try to shrug your right shoulder. Relax. And again. Done. Proximal to the elbows, I have the patient lift up towards the ceiling. And relax. Again. Relax. Final stretch. Resting position. That's the treatment for pec minor. The abductor latissimus dorsi. Bring his arm out here. Bring your arm down towards me. There you go. This tightens the adductor latissimus dorsi. Relax. Final stretch. And that concludes the OMM practice.